Secretary for Food and Health. President, I move the second reading of the Pharmacy and Poisons Amendment Bill 2014, the bill, so as to implement the recommendations contained in the report of the Review Committee on the Regulation of Pharmaceutical Products in Hong Kong, which require amendment to existing legislation. We take this opportunity to update and clarify the Pharmacy and Poisons Ordinance and the subsidiary legislation so as to make our mechanism clearer and consistent. In the light of a number of incidents concerning pharmaceutical products in Hong Kong in early 2009, the Review Committee was set up in March 2009 to conduct a comprehensive review on the existing regime for the regulation of pharmaceutical products. After examining in detail the existing regulatory regime, the Review Committee considers that while the framework and the rationale behind the existing regime is sound and should be continued to be adopted, the coverage and depth of the regulatory measures should be enhanced. In December 2009, the Review Committee issued a report and made a total of 79 recommendations on improvement measures. Relevant departments and organizations have already or are in the process of implementing 59 recommendations which do not require legislative amendments. For the remaining 16 recommendations, they require the amendment to the PPO and the subsidiary legislation. To assess the impacts of the proposed legislative amendments, we commissioned a consultant to conduct a regulatory impact assessment, RIA. Having considered the RIA result and views expressed by the relevant stakeholders, we have decided to propose legislative amendments to PPO and the subsidiary legislation to implement the majority of the 16 recommendations which are conducive to enhancing the regulatory regime without causing significant impact to the relevant parties. For the remaining recommendations, we'll monitor the situation and formulate appropriate implementing measures in due course. As a result of the regulatory regime and mechanism covering pharmaceutical products, the bill covers a lot of areas, like enhancing the regulation of relevant traders and registered pharmacists. And we'd also like to enhance the control of the pre-market control of drugs. For the general provisions to align with the international practice, we propose to revise the definition of pharmaceutical product in the PPO in accordance with the definition adopted by the European Union, in order to cover also a substance or combination of substances presented as having properties for treating or preventing disease in human beings or animals. On the other hand, as recommended by the Review Committee, we propose to empower the Pharmacy and Poisons Board to promulgate corresponding codes of conduct and codes of practice in order to provide practical guidance and enhance monitoring for the conduct of activities of registered pharmacists as well as manufacturers, wholesalers, and retailers. For the manufacturers, we would like to introduce the registration system of authorized persons in the PPO, and we mandate that each licensed manufacturer must at least employ one AP who is to be responsible for the quality of pharmaceutical products. We'll also tighten up the control of pharmaceutical products, and we will now provide that even secondary packaging must also be carried out by licensed manufacturers so as to reduce drug incidents caused by wrong labeling or wrong content of carton boxes. For wholesalers, we now propose that wholesalers of non-poisons should also be subject to a licensing regime, so that the licensing regime currently covering the wholesalers of poisons would also be extended to wholesalers of all pharmaceutical products, that is poisons and non-poisons. And we propose to merge the proposed licensing of wholesalers of non-poisons, the registration of importers or exporters of pharmaceutical products, with the licensing of wholesalers of poisons, and subject these traders to the same set of licensing, control, and inspection. and we are going to streamline and standardize the requirements. We also propose that there should be a need to keep transaction records for all pharmaceutical products covering both poisons and non-poisons in relation to wholesalers, so as to facilitate the recall of products. And then at the retail level, the bill would tighten up the regulation over authorized sellers of poisons. This includes the storage of poisons in Schedule 1 in the PPR, being extended to all poisons in List 1 of the PLR. There is the portion list regulation. Other amendments would also include the following, like empowering the court to order the recovery of all expenses in relation to the taking, examination, and analysis of any sample of pharmaceutical products in the case of a convicted defendant. Moreover, we also propose to simplify the legislative process for the registration of pharmaceutical products so as to expedite the vetting and registration of pharmaceutical products and poisons so that needy patients can benefit from the development of new pharmaceutical technology earlier. In addition, the word poison may give the impression that it is not suitable for consumption or taking. So we propose that we should use the term prescription drug or drug under supervised sales to replace the word poison on the labeling. We have already carried out a lot of consultation in the course of studying the recommendations of the review committee and in the course of drawing up the bill. On the 24th of January 2010, at the plenary session of the Hong Kong Pharmacy Conference, the participants discussed the various recommendations in the review committee report. And during the RIA conducted by the consultant, we have also consulted the views of the stakeholders. Hong Kong U also carried out a public opinion poll so as to understand the feedback from the public. Generally speaking, the public as well as the stakeholders are in support of the recommendations so as to enhance the regulatory regime. On the 18th of November 2013, we attended the meeting of the Health Services Panel of the LegCo so as to brief members on our proposed amendments. The HSP also invited relevant organizations to a special committee meeting held on the 10th of December 2013 so as to give views on the recommendations. On the 10th of February 2014, at a special meeting, they gave us our support. I appeal to members to support the bill so that we can earlier improve the regulatory regime for pharmaceutical products in Hong Kong so as to afford better protection for the members of the committee. So I speak thank you. I now propose the question to you, and that is that the Pharmacy and Poisons Amendment Bill 2014 be read the second time. In accordance with the rules of procedure, the debate is now adjourned and the bill is referred to the House Committee.